I want to talk to you today about a symptom that understandably worries people and that a great many older adults experience at some point, and that ranges from harmless to a dire emergency: chest tightness, that feeling of pressure, squeezing, heaviness, or constriction in the chest. Because chest tightness can mean many things, from benign muscular or digestive causes to a heart problem or even a heart attack, and people often either panic over harmless chest sensations or, far more dangerously, dismiss or delay over ones that signal a heart attack. So it's genuinely important to understand what chest tightness can mean, which features point to the heart and an emergency, and what to do. So today I want to explain what chest tightness can mean, the crucial distinction between the kind that needs emergency care and the kind that's less urgent, the features that point to the heart, and exactly what to do, especially the life-saving message about when to call for help. And I'll be clear and direct because while not all chest tightness is a heart attack, some is, and knowing when to treat it as an emergency and act immediately can save your life. So this is genuinely important knowledge in partnership with your doctor and emergency services. Let me start with the most important principle because it governs everything else. When in doubt about chest tightness, especially in an older adult, treat it as a possible heart problem and seek help. Because chest tightness can be a sign of a heart attack or other serious heart problem, and because, as I've discussed, heart attacks can present subtly or atypically in older adults, the single most important principle is that you should not try to diagnose serious chest tightness yourself or talk yourself out of getting help, but should treat chest tightness that could be from the heart as a possible emergency and seek help, because the cost of calling and it being nothing is trivial, while the cost of dismissing a real heart attack is catastrophic. So while I'll explain the various causes and features, the overriding message is that significant, unexplained, or worrying chest tightness, especially with the features I'll describe, should be treated as a possible heart emergency, and you should call emergency services rather than wait, because it's far better to be safe. So the most important principle is to treat significant or worrying chest tightness as a possible heart emergency and seek help rather than self-diagnose or delay, because being safe is far better. So when in doubt, treat chest tightness as a possible emergency. So the overriding principle is to seek help when in doubt. Let me give you the features that point to a heart cause and an emergency, because recognizing them is critical. Chest tightness is more likely to be from the heart, and to be an emergency when it has certain features. Call emergency services immediately if chest tightness or pain is severe, crushing, or feels like a heavy pressure, squeezing, or band around the chest, comes on with exertion or stress, is accompanied by other heart attack symptoms: shortness of breath, sweating or a cold sweat, nausea, lightheadedness, or feeling very unwell, spreads to the arm, especially the left, the jaw, neck, back, or stomach, lasts more than a few minutes or doesn't go away with rest, or is simply severe or frightening. Remember, as I've discussed, that in older adults, heart attack symptoms can be milder or atypical, so don't wait for dramatic crushing pain and chest tightness with any of these features, or that's unexplained and worrying, should prompt calling emergency services immediately. So chest tightness that's severe or crushing comes on with exertion, spreads to the arm, jaw, neck, back, or stomach, comes with breathlessness, sweating, nausea, or lightheadedness, or lasts more than a few minutes, points to a possible heart attack, and warrants calling emergency services immediately. So these features signal a possible heart attack needing immediate help. So recognizing the heart attack features is critical. Let me explain why immediate action on these matters so much, because it's the heart of the life-saving message. As I've discussed about heart attacks, a heart attack is damaging the heart muscle minute by minute, and the faster emergency treatment restores blood flow, the more heart muscle is saved and the better the chance of survival and recovery. So time is muscle and every minute counts. This is why chest tightness with the heart attack features must prompt calling emergency services immediately, without waiting to see if it passes, without trying to drive yourself, and without talking yourself out of it, because delay costs heart muscle and lives. The deadliest mistake, as I've discussed, is delay, talking yourself out of it, not wanting to make a fuss, or waiting and hoping, which costs precious time. So immediate action on heart attack-like chest tightness matters enormously because the heart is being damaged minute by minute. Rapid treatment saves heart muscle and lives, and delay is catastrophic, so you must call emergency services immediately rather than wait. So immediate action saves heart muscle and lives, which is why you must not delay. So acting immediately is the life-saving response. Let me give you the less urgent and benign causes too, for balance, because not all chest tightness is a heart attack. Chest tightness can also have less urgent or benign causes, which is worth knowing though, crucially, this should not lead you to dismiss serious chest tightness. Benign or less urgent causes include muscular or chest wall pain from strain, movement, or injury, which is often sharp, localized, and worsens with movement or pressing on the spot. Digestive causes like heartburn or indigestion, which can cause chest discomfort or burning, sometimes related to eating. Anxiety or panic, which can cause chest tightness. And respiratory causes. These benign causes are common. But here's the crucial caveat. You cannot reliably tell on your own whether your chest tightness is benign or a heart problem, because they can feel similar and heart problems can present atypically, especially in older adults. So the existence of benign causes is not a reason to dismiss chest tightness, but rather, the safe approach remains to treat significant, unexplained, or worrying chest tightness, especially with heart attack features, as a possible emergency and seek help. So while chest tightness can have benign causes like muscular pain, indigestion, or anxiety, you can't reliably distinguish these from a heart problem yourself. So this is not a reason to dismiss serious chest tightness, and the safe approach is still to seek help when in doubt. So benign causes exist, but don't justify dismissing serious chest tightness. So you can't safely self-diagnose, so seek help when in doubt. Let me address the non-emergency chest tightness that still warrants seeing your doctor, because some needs assessment without being an emergency. Some chest tightness, while perhaps not an emergency in the moment, still warrants seeing your doctor for assessment. For example, chest tightness or discomfort that comes on reliably with exertion and eases with rest, called angina, can be a sign of coronary artery disease, the heart not getting enough blood under exertion, and warrants seeing your doctor for assessment and management, even though a stable, known pattern relieved by rest may not be an emergency each time, while any new, changing, worsening, or unrelieved exertional chest discomfort should be treated as a possible emergency. Recurrent, unexplained, or persistent chest tightness warrants seeing your doctor to find the cause. And if you have known angina, follow your doctor's guidance on your medication and when to seek emergency help, since a change or worsening or chest pain not relieved as usual warrants emergency care. So chest tightness with exertion that eases with rest, or that's recurrent or unexplained, warrants seeing your doctor for assessment, while any new, worsening, severe, or unrelieved chest tightness should be treated as a possible emergency. So some chest tightness warrants doctor assessment, while emergencies warrant immediate care. So non-emergency chest tightness still warrants checking with your doctor. Let me be absolutely clear about what to do, because this is the crucial, practical, life-saving part. If you have chest tightness with any heart attack features, severe or crushing pressure or squeezing, coming on with exertion, spreading to the arm, jaw, neck, back, or stomach, with breathlessness, sweating, nausea, or lightheadedness, lasting more than a few minutes, or simply severe, unexplained, or frightening, call emergency services immediately. Say you think it may be your heart, and do not wait to see if it passes. Do not drive yourself, and do not talk yourself out of it, because it's far better to call and be wrong than to delay a real heart attack. While waiting, sit or lie down and stay calm, and follow any instructions from the emergency operator. For chest tightness that comes on with exertion and eases with rest, or that's recurrent or unexplained but not an emergency, see your doctor for assessment, since it can signal a heart condition worth managing. And if you have known angina, follow your doctor's plan and seek emergency help for any change, worsening, or unrelieved pain. So call emergency services immediately for chest tightness with heart attack features or that's severe, unexplained, or frightening without delay, and see your doctor for exertional, recurrent, or unexplained chest tightness that isn't an emergency. So act immediately on emergency features and see your doctor for the rest. So the action is to call immediately when in doubt and otherwise see your doctor. Let me paint you a picture of how this matters because the contrast is life and death. Picture a man in his 70s who develops a heavy tightness in his chest with some breathlessness and a cold sweat, not the dramatic crushing pain he associates with heart attacks. In the dangerous version, he tells himself it's probably indigestion or nothing, doesn't want to make a fuss, and waits to see if it passes. And by the time he or someone realizes it's a heart attack, much time and heart muscle are lost, with grave consequences, the delay having cost him. Now picture him knowing what you now know. He recognizes that chest tightness with breathlessness and sweating, even without dramatic pain, can be a heart attack, especially in an older man, and treats it as a possible emergency, calling emergency services immediately and saying he thinks it's his heart, without waiting. He gets rapid treatment, much of his heart muscle is saved, and he survives and recovers well. In another version, his chest tightness comes on only with exertion and eases with rest, and rather than ignore it, he sees his doctor, who diagnoses angina and manages it, reducing his risk. The contrast shows that treating worrying chest tightness as a possible emergency and getting exertional or recurrent tightness checked, rather than dismissing or delaying, makes the difference. So treating chest tightness seriously and acting promptly protected him. And let me speak directly to those of you caring for or close to an older person, because you may be the one to recognize and act on chest tightness. Understand that chest tightness can range from benign to a heart attack, that heart attacks can present subtly in older adults, and that the safe approach is to treat significant, unexplained, or worrying chest tightness as a possible emergency. So if a loved one has chest tightness with heart attack features, severe or crushing pressure, coming on with exertion, spreading to the arm, jaw, neck, back, or stomach, with breathlessness, sweating, nausea, or lightheadedness, lasting more than a few minutes or simply severe or frightening, call emergency services immediately. Say you think it may be their heart and don't wait. Don't let them talk themselves out of it, and don't drive them yourself, because acting fast saves heart muscle and lives. Don't be reassured by the absence of dramatic pain, since older adults can have milder symptoms. For exertional chest tightness that eases with rest, or recurrent or unexplained tightness, encourage seeing the doctor for assessment. Helping a loved one treat worrying chest tightness as a possible emergency and act immediately while getting non-emergency tightness checked can genuinely save their life. So your recognition and immediate action on chest tightness can be life-saving. Let me draw this all together. Chest tightness, that pressure, squeezing, or heaviness in the chest, ranges from benign to a dire emergency, and the overriding principle is to treat significant, unexplained, or worrying chest tightness, especially in an older adult, as a possible heart emergency and seek help rather than self-diagnose or delay, because being safe is far better. Chest tightness points to a possible heart attack, warranting calling emergency services immediately when it's severe or crushing, comes on with exertion, spreads to the arm, jaw, neck, back, or stomach, comes with breathlessness, sweating, nausea, or lightheadedness, lasts more than a few minutes, or is simply severe or frightening, remembering that older adults can have milder symptoms. Immediate action matters because the heart is being damaged minute by minute, and rapid treatment saves heart muscle and lives, so you must not delay, drive yourself, or talk yourself out of it. While chest tightness can have benign causes like muscular pain, indigestion, or anxiety, you can't reliably distinguish these yourself, so this isn't a reason to dismiss serious tightness. Chest tightness with exertion that eases with rest, or that's recurrent or unexplained, warrants seeing your doctor for assessment, so call emergency services immediately for chest tightness with heart attack features or that's severe, unexplained, or frightening, and see your doctor for exertional, recurrent, or unexplained chest tightness that isn't an emergency. So here's what I'll leave you with. First, hold the overriding principle. Treat significant, unexplained, or worrying chest tightness, especially in an older adult, as a possible heart emergency, and seek help rather than try to diagnose it yourself or talk yourself out of it, because it's far better to call and be wrong than to delay a real heart attack. Second, recognize the features that point to a heart attack and warrant calling emergency services immediately. Chest tightness that's severe or crushing comes on with exertion, spreads to the arm, jaw, neck, back, or stomach, comes with shortness of breath, sweating, nausea, or lightheadedness, lasts more than a few minutes, or is simply severe or frightening, remembering that older adults can have milder, atypical symptoms, so don't wait for dramatic pain. Third, understand why immediate action matters. A heart attack damages the heart minute by minute, rapid treatment saves heart muscle and lives, and the deadliest mistake is delay, so call emergency services immediately, without waiting, driving yourself, or talking yourself out of it. Fourth, know that while chest tightness can have benign causes like muscular pain, indigestion, or anxiety, you can't reliably distinguish these from a heart problem yourself, so this is not a reason to dismiss serious chest tightness, and the safe approach remains to seek help when in doubt. And fifth, see your doctor for chest tightness that comes on with exertion and eases with rest, which can be angina worth managing, or that's recurrent or unexplained, while treating any new, worsening, severe, or unrelieved chest tightness as a possible emergency. And if you have known angina, follow your doctor's plan and seek emergency help for any change or unrelieved pain. Chest tightness ranges from harmless to a heart attack, and knowing when to treat it as an emergency and act immediately can save your life. So this is genuinely important knowledge. So take care of yourself. Treat worrying chest tightness as a possible emergency. Call for help immediately when in doubt, and see your doctor for non-emergency chest symptoms. And because chest tightness can be a life-threatening heart attack, please treat significant, unexplained, or worrying chest tightness as your reason to call emergency services immediately, without delay or self-diagnosis, and see your own physician for exertional, recurrent, or unexplained chest tightness that isn't an emergency.